Welcome back to McLaren Port Huron's Today's Health, and we're talking to board-certified OBGYN Dr. Stacy Tremp, and we're talking about fibroid. So at what point, Dr. Tremp, do you even consider surgery for fibroids?
I think a lot of it depends on the patient's age and the symptoms that they're complaining of and the size of the fibroids. Some patients have very small fibroids and you can manage them conservatively until they're done with childbearing and then readdress their symptoms. If they have very large fibroids and they're done with childbearing, they've had their babies, they don't want to get pregnant again, then you can consider surgical options, whether it's myomectomy or just remove the fibroid itself, which, you know, if someone is done with childbearing, I wouldn't recommend. I would say they just need a hysterectomy at that time, which is something that can be done with the Da Vinci robot, depending on the size of the fibroids. We are limited by abdominal space, so sometimes the Da Vinci, while I like it as my first option for patients, it's not the best option for patients with very, very large fibroids. So that's how you kind of approach it. If a patient is still within childbearing years, then it depends on the size of the fibroid whether or not we offer them a myomectomy or not. And majority of the time, we just watch and let them get through their childbearing years depending on the size of that fibroid.
So let's talk a little bit about a myomectomy and maybe explain what that term myomectomy is, where it comes from.
So myo meaning fibroid more than anything, and ectomy, taking out. So taking out the fibroid is essentially what that term means, and we can do it laparoscopically with the Da Vinci Assist, which is a nice option. The Da Vinci is something I think that a lot of patients think is mystical, like the robot is doing the surgery itself, when in actuality the surgeon controls the robot. We are sitting at a console a little bit away from the patient, but we control all of that movement that's happening with the arms of the robot itself. I like to say that when you do straight laparoscopy, such as this picture is showing, you only have front, back, and side-to-side movement. When I'm using the Da Vinci, I actually have hands that can rotate in 360, so I can use those instruments just like they're my hands. I can tie knots just like I would be doing it as an open procedure, but using a minimally invasive procedure. With the Da Vinci and a myomectomy, we would use that robotic approach and making a small incision on the top of the fibroid, shelling out or taking out that fibroid, and then suturing that defect closed. That fibroid would then most likely be removed through one of the small port sites after the surgery is completed.
Well, let's talk a little bit about hysterectomy then.
Yeah.
How do you do that? And
so majority of my hysterectomies are done with the Da Vinci robot because I feel it's a safe, minimally invasive option for patients that gets them back to their life sooner. And you know, you can see everything very well with the Da Vinci. It's a 3D high-def option for patients. And I think we should utilize this new technology that we've had for 11 plus years, I want to say, that we have been using the Da Vinci for GYN procedures. There's 4 incisions on the abdomen that will be made, so 2 operating ports that I actually use my hands. I always say they're my hands. There's a camera port that's by your belly button, and then we usually have another physician at the bedside to hand us things should we need them. I use suture during the procedure, so that's another reason to have that bedside assistant. The uterus is connected by certain structures that support it and certain blood supply that goes to the uterus. So when we're doing the hysterectomy, we disconnect those supportive structures and then we cauterize or seal those vessels. And then once the uterus is cauterized from its vessels, the supportive structures are disconnected, really the only remaining attachment is the vagina. At the top of the vagina, that's where the cervix lives. So you'll make a small incision around the cervix and that uterus, and if you're taking the fallopian tubes and the ovaries, will be delivered through the vagina, that vaginal opening, and then that defect will be closed. A lot of patients, that's freaky to them. They think that's very odd, but you have to remember that the vagina is a blind tube. It's always been a blind tube, and even after a hysterectomy, it will remain a blind tube. So there's no real change in sexual function after a hysterectomy is done. The cervix provides no sexual intervention or pleasure during intercourse.
So I'm just imagining there's so much less recovery time.
Correct.
When you have a surgery like that.
Yeah, so I mean, if you consider the olden days that we used to do an open procedure, we'd actually open the abdomen and then do things with a laparotomy, being able to do 4 small incisions and delivering that uterus and possibly the fallopian tubes and the ovaries through the vaginal opening. Patients are out of the hospital usually under 24 hours. Their return to bowel function, passing gas, having bowel movements is pretty quick, and they're able to get back to their daily lives much sooner than if they had an open procedure.
Well, this has been very good practical information. Do you have closing comments?
I think that if patients listen to their body, that's a really important thing, to bring those concerns to their physician, and remember that it's important that they see their OBGYN once a year. PAP guidelines have become very loosey-goosey, and a lot of patients think that they don't need to see their OBGYN as frequently, but it's important that we bring these concerns to our OBGYN, and that's why I like that annual visit, because sometimes they'll push off things, and if I start questioning them, issues can come up and we can solve those issues for these patients.
Thanks so much for joining us.
Thanks for having me.
And thank you for joining us. If you have any questions about anything we talked about today, you can call us at Health Access. That's 1-800-228-1484. Or you can always go to our website. That's mclaren.org/PH contact. You can always get great health information, get a copy of this program. That's mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.